Mind Matters podcast by Dr. Tamer Metwally.
Hello and welcome everybody to this episode of Mind Matters by RNC. I am Dr. Tamer Metwally, a consultant psychiatrist at RNC, and today we have the pleasure of having Dr. Bobby Sebastian. He's going to be talking to us about the important and current subject of narcissistic personality disorder. I mean, I say current, it's current and historic at the same time. Welcome, Dr. Bobby.
Thank you.
To our program. So can we today visit this very, very important topic of narcissistic personality disorder? Perhaps why don't we start by historical information? How did the term narcissistic personality disorder come about?
Actually, the word Narcissus itself is from the Roman times, when the Roman poet Ovid, as mentioned in the 8th century AD about Narcissus and Echo, the story in a book called Metamorphosis. He gets punished by the Roman gods for not accepting Echo as his companion, and then he has to, look himself in the mirror image in the water. And there's a very nice painting by Caravaggio on the Narcissus. So the term Narcissus means self-love. And narcissistic personality disorder itself, the term was coined by the psychoanalyst Heinz Kohut in 1968. And then there was a lot of studies done on what exactly the narcissistic personality disorder itself is and how they present in the population.
How fascinating! It goes back a long way. The term narcissistic personality, and you've mentioned something about research, and I think that this is a very, very important subject that I think our viewers would want to know about. But why don't we start by your thoughts and about what are the symptoms of narcissistic?
We talk about the triad of symptoms, which is excessive sense of grandiosity or self-praise or self-admiration. And then there is a lack of empathy or feelings for the others. So these are the core criteria. But then they have, as we know, the DSM-5 and the ICD-11. In the DSM-5, they have the 9 criteria, out of which 5 of them should be satisfied to fulfill that.
What?
Some of these criteria include a sense of grandiosity or inflated self-esteem, which can sometimes be mistaken for hypomania. But then here it is more of a personality trait. Along with that, they have lack of empathy or feelings for others, and then they go on a spree of sabotage on different fronts, and then they end up with clinical settings. They usually come up with other coexisting conditions like depression or with substance abuse. Usually there are a lot of research showing link with alcohol and cocaine abuse in people having underlying narcissistic personality disorders. But by themselves, they don't come for treatment for just the personality disorder itself. So it is usually picked up on clinical examination. And in clinical settings, the prevalence is around 15%.
15% prevalence in the general population.
In the clinical settings.
In the clinical settings.
In the general population, the studies, mostly the Western data, point at 0.8%, with a lifetime prevalence of 6.2%. And
big number.
Yeah. And they have found that the prevalence in men is more than the women. So in the men, it is around 7.7%, while in the women, it is 4.8%.
It's interesting that you talk about the difference between men and women, and I think this takes us to the sort of, I have seen this time and time again in my practice, I'm not sure about you, but most people, when they have a disagreement, they feel that their partner, be it he or she, is suffering from a narcissistic,
exactly.
Or he is narcissistic, or she is narcissistic. And what are your thoughts about this, and given the sort of symptoms that you've just mentioned?
Usually when even people come in for couples therapy, we come across, details from the spouse, so who have lived with the person, and so we corroborate the data from close family members or friends or relatives. So usually they present in the clinical settings when they have had a job loss, or when they have experienced depression because of financial mismanagement, and sometimes they have these kind of surprise presentation where they call the shame suicides, where they are the fragile ego is affected by that event, and then they present with suicidal ideation. So that is when they come in for treatment.
And this suicidal ideation, I guess maybe so then we can make things a little bit sort of more straightforward or easier for our viewers. So we talked about how it can present, and from what you've just said, it can present itself with few different other conditions. So you talked about substance misuse, perhaps alcohol and cocaine.
Yeah.
What are the other comorbid or perhaps presentations of people with narcissistic personality disorder?
Sometimes we get, the prevalence in the forensic settings is around 6% in the forensic settings, and in the military, they have also done studies showing that it is around 20%, probably because of the hierarchical, the structure that they have there. So some of these presentations are basically when they experience also like a misfortune, or like I said earlier, a job loss or a negative life event where there is a divorce or separation going on because of the personality itself. So when there are maladaptive personality structure that is interfering with their social, occupational well-being, that is the time when we see them in the clinical setting.
Okay, and when before we come to the clinical setting, you mentioned something about the research and the evidence, the current evidence for perhaps narcissistic personality disorder. Would you shed some light on that?
Yeah, so basically they have done studies at twin studies, and in the general population they have found most of the data is in favor of genetic and brain imaging studies, which have showed decreased gray matter volume in the medial prefrontal cortex and the anterior insular cortex, which is the structure required for compassion and empathy. So this is one of the finding. And the other things they have found in the psychosocial, because we follow the biopsychosocial model. So in the psychosocial aspects, early parental overindulgence, neglect, harsh disciplining, going through early trauma, abuse. So these are all the things that contribute. So it is more like a double hit hypothesis, where you have the genetic predisposition plus the psychosocial aspect, which eventually present with. So we have these two main subtypes. They call it the covert or the grandiose and the overt. So the covert subtype is where they get into trouble with the law. They are mostly, getting into trouble with their employer. But the overt type is where they present with depression, shame, and resentment, and so the internalizing kind of symptoms. Yeah.
And that takes us perhaps nicely to what can we do to help. So you have somebody with narcissistic personality disorder, be it nature or nurture, is another way of sort of looking at it, or perhaps both as the sort of the etiology behind it, and for a reason or another they've presented to us in clinic. What would you recommend as the form of treatment?
Yeah, so the main focus will be on psychotherapeutic methods. So they have mainly focused, most of the research is in the psychoanalytic, psychodynamic psychotherapy, and the dialectical behavior therapies. Psychoanalytical therapy, it is more about schema-based, mentalization-based treatment, and transference-focused therapy, helping them to kind of identify their maladaptive behaviors, helping them to kind of, gain insights and work on correcting the patterns of behavior that leads to hampering their day-to-day interpersonal as well as emotional well-being. So that is what we do here at RNC with our team of psychologists. And mostly they come into the psychiatrist for treatment when they have a coexisting depression or substance abuse. That is a time when we have a combination of medication management with psychotherapy.
Thank you, Dr. Sebastian, for sharing your insights on the treatment and perhaps everything to do with narcissistic personality disorder.
Thank you, Dr. Tamer.
And I thank the viewers for being with us. We've covered an important topic today, and please stay tuned for more insights and perhaps different angles of narcissistic personality disorder.